Hello students, today we will discuss about erythropoiesis. What is erythropoiesis? It is the generation of the red blood cell. Why it is necessary? Because we know that around 120 days is the lifespan of a RBC. So new RBC generation is mandatory for different functions in the body. Today our topic of discussion is different factors which regulate erythropoiesis. First come to the local hormones. Some local hormones like interleukins are secreted from T lymphocytes and they are mainly 1, 3 and 6. Stem cell factors and granulocyte monocyte colony stimulating factor. These are the local hormones. Now we all know that erythropoietin plays an important role in formation of RBCs, mostly during the time of hypoxia. It is secreted from the kidney and its role is mainly from the level of CFUE. Also it promotes hemoglobin synthesis and help in different maturation process of RBC from pronormoblast onwards. Erythropoietin also promotes release of RBC from the bone marrow into the peripheral circulation. Now comes different vitamins like vitamin B12. It is very important for erythropoiesis. Normal requirement is 1 to 2 microgram per day. Its deficiency causes pernicious anemia, so it is also called an anti-pernicious factor. How vitamin B12 is absorbed? It is absorbed with intrinsic factor. Where it is absorbed? It is absorbed as a intrinsic factor cyanocobalamin complex in the ileum, and the process is endocytosis. So vitamin B12 deficiency causes secondary folate deficiency and decreased synthesis of methionine, which hampers the myelination of the neurons, and exogenous folic acid can reduce the hematological symptoms, but neurological symptoms still persist unless we give vitamin B12 as an injectable form. Role of vitamin C is also very important. It converts the iron into the absorbable form in the GIT. Then different nutrition factors like protein, different cofactors, copper and cobalt, and iron, which is a part of heme. Hormones which regulates growth hormone, ACTH, androgen. This promotes the erythropoiesis. Estrogen, it decreases the erythropoiesis. Different drugs like theophylline, which is a adenosine antagonist, it decreases the erythropoietin secretion. Estrogen, it also decreases erythropoietin secretion. How? By decreasing synthesis of globin in liver and depressing the erythropoietic response to hypoxia. Now come to some applied basis. Applied basis is pernicious anemia. It is an autoimmune anemia. Why it occurs? Autoimmunity occurs against the parietal cell of the stomach. You know, from here the intrinsic factors are secreted and it is very essential for absorption of vitamin B12. So here the treatment is not oral vitamin B12, it is the injectable form of vitamin B12, because oral vitamin B12 cannot be absorbed in this case. And alcoholism causes macrocytic anemia. Folate deficiency can occur in alcoholism and it has a direct toxic effect on erythroid precursor. So Alcohol can also cause anemia. Thank you friends. Please like and share my video. Thank you.